So, hi everyone, good day. My name is Kisa Marlatombo, your student nurse from Davao Doctors College, and today I am going to perform the perineal flushing. So, perineal flushing involves the washing of the genital and the rectal areas of the body, and this prevent the irritation and odors and infection. So, now let's prepare the necessary equipment such as the basin. So, assuming this is such as a bedpan. So, the picture with warm water, the rose sheet, the kidney basin, the clean gloves, and the perineal pad. So, then the 7 cotton balls, and of course, the another 7 cotton balls in antiseptic solution. So, this helps us to prevent the time and energy. And don't forget to perform the hand washing to prevent the spread of the microorganism. So now, after preparing the necessary equipment, let's explain the procedure and treatment to the clients and how she can participate. And provide the clients the opportunity to ask of her concern, and of course establish the good rapport to the client so that she would feel uncomfortable during the assessment. And of course, ask how the client she would like to call during the assessment. So, ensure the client's comfort and privacy. So, ma'am, my name is Kisa Marlatombo, your attending nurse for today. And may I see your wristband, ma'am? And please state your complete name. And when is your birthday? Okay, ma'am. And what do you want me to call you? Okay, Ma'am Jazz. So, Ma'am Jazz, the procedure that I will be doing is that I'm going to perform the perineal care to you. So, this is to remove the normal perineal secretions, odor, and of course, prevent some infections and contamination of your genital. So, I will be touching some parts of your body, so especially to your genitals. So, is that okay with you, Ma'am Jazz? Okay, so do you have any clarification or concerns? Okay, so as you can see, I closed the curtain so no one from outside will disturb us, and of course to respect your privacy. Okay, in a bit, we are going to start the procedure. So, ensure to screen the patients or lock the door of the patient's room to provide the patient's privacy. So now, cover her body and legs with a bath blanket. Position at the corner of her head, and the other corner of her feet, and other corner of her side. So now, position the patient on a dorsal recumbent with her knees flexed, and put the patients of the bedpan. So this is to prevent the bed from the becoming soiled. So, ma'am, I'm going to position your legs with the dorsal recumbent. Okay? So now, drape the patients, exposing only the parts to be clean, so minimum exposure. Lessen the embarrassment, and of course, to provide warmth. So now let's inspect the perineum and the flush of the perineal are with warm water. So note for any particular inflammation, swelling, excessive discharge, toxication from the office of course presence of other. So warm water is used to prevent the chelate dissolved to the blood clots. So now get the cotton ball soaked in the cleansing solution using pick up the forceps to maintain the sterility. So now cleanse the external genitalia starting from the midline of the symphysis pubis down to the anus. And don't forget to never retrace a stroke to prevent the contamination of the area. So now, with the second cotton balls, cleanse starting from the moon's pubis and figure out of by 7 way of external labium toward the anus, then discard. So secretions is the tend to collect around the labia minora, facilitates the bacterial growth. Now do likewise on the opposite sides with the next cotton balls. So now with the 4 cotton balls, clean starting from bones pubis in figure of 7 by way of the external labium toward the anus, then discard. So now do likewise on the opposite side with the next cotton ball. So with another cotton balls, cleans with grown starting from the grown growing up the light I tight. Use other side of the same cotton balls for the near grown. Then do likewise. So now let's flush the perineum thoroughly with sterile warm water. So now using dry cotton balls, dry the perineum with the same stroke as above, so moisture support the growth of the many microorganisms. Now remove the bedpan gently and turn the patient to the side. So if necessary, take once with the cotton balls and clean one of the other side of buttocks. Then cleanse the other sides of the buttocks. Then dry the both buttocks to provide comfort. So now, let's turn the patient into her back and make her comfortable. So, spray the antiseptic as needed. So now this is to promote healing. So put the perineal pad with an and-down motion as needed to prevent the contamination of vagina and urethral from the anal area. So now, that's aftercare of the materials used, and don't forget to perform hand washing and record the treatment during the patients and discharge. Observe for the documentation purpose that the procedure was done and means of the communication.